I'm working as a vascular surgeon in Newton. And I want to say about abdominal aortic aneurysm, a hidden time bomb. It is one of the important aneurysm that occurs in our body. Actually, most of the aneurysm occurs in inferior aorta, and other sites are also important. One of the greatest scientists, Albert Einstein, had died to this disease. And now, what is abdominal aortic aneurysm? It is a permanent localized dilatation of the abdominal aorta. The disorder is conventionally diagnosed if the aortic diameter is 30 centimeter or more, or sometimes when diameter is 1.5 times than normal. Why? Abdominal aortic aneurysm is a serious healthcare issue. Yes, abdominal aortic aneurysm is a serious healthcare issue, as because an estimated 80 million people aged 60 years and older are at risk in Western Europe, and it is the 13th leading cause of death in Western societies, and also it is a silent killer. Incidence of abdominal aneurysm is estimated about 4 to 8% of the male population aged 65 years or older, and comparatively it is 0.5 to 1% less in females. Incidence of abdominal aortic aneurysm has been estimated as a result of large screening program. Incidence of abdominal aortic aneurysm is gradually increasing as the population is aging. What pathological changes occur in abdominal aortic aneurysm? First of all, inflammatory process started in the wall, then causing breakdown of elastic elements, causing decreased tensile strength, and leading to expansion of the aorta. What risk factors? Risk factors are male sex, smoking, history, hypertension, family history, increasing age, atherosclerosis, COPD, and also infection and inflammation of the aortic wall. And what type of abdominal aortic aneurysm? Morphology, two types, true and false, that's severe aneurysm. True aneurysm is also fusiform and circular, and this circular aneurysm is prone to rupture or blast. Why early diagnosis of abdominal aortic aneurysm is so important? As because operative modality of treating the ruptured aneurysm is 80%, and also for elective cases it is only 2 to 7%. So, if we want to prevent abdominal rupture, then we should screening program to take aged patient and timely elective repair. And what occurs if abdominal aneurysm are left untreated? If aneurysm diameter 5 to 5.9 centimeter, then 25% chance of blast. And it is if 6 to 7 centimeter, then chance of 35%, and also more than 7 centimeter, there may be chance of 75% blast. How can we diagnose abdominal aneurysm? Clinical features, physical examination, and simply investigation like ultrasound. Ultrasound is a sensitive test for all abdominal aneurysm, and it is painless, non-invasive, and it is cost effective. What are the patient at risk? Patients are that are over 60 years and old age, and who are a smoker, hypertensive, and give history of abdominal aortic aneurysm, family history. Why? What protocol we should follow? And also in Bangladesh we have followed this. If aneurysm diameter less than 4 centimeter, we follow the patient annually. If 4 to 5 centimeter, we follow up 6 monthly. And if diameter more than 5 centimeter or if symptomatic, then we should give under treatment and endovascular and surgical treatment. And picture showing that surgical treatment, Y graft, and also endovascular treatment, EVAR and TVAR. Who are the candidates for open abdominal aortic aneurysm repair? Unfavorable anatomy for EVAR, need to preserve patency of inframagenetic artery, renovascular variant, inability to preserve at least one of the hypogastric artery with EVAR, symptomatic or ruptured juxtarenal aortic aneurysm, inadequate access vessel, strong patient preference, prolonged life expectancy, inflammatory abdominal aneurysm, and also mycotic abdominal aortic aneurysm. And what are the advantages of open surgical repair? Aneurysm opened, graft sewn in aorta, wrapped and closed around the graft. It is established procedure, exclude aneurysm, prevent side growth, proven long-term result. What are the disadvantages? Disadvantage is in long incision in the abdomen, aortic cross-clamp time, prolonged procedure, prolonged hospitalization, and prolonged recovery time. And now, what are the advantages of endovascular stent grafting? It is minimally invasive, reduces risk of death, faster recovery, improved functional outcome. And what are the complications of endovascular stenting? This complication and irritation is like that: endolymph, stent graft migration, and modular dislocation. About the aneurysm management, including EVAR and TVAR, and also fever will discuss next speaker by Professor Cornell Bhai. And for endovascular grafting also we should precise early evaluation needed, like adequate vascular access, appropriate landing zones, porosity, calcification, thrombus, and also precise sizing. We need 3 cm CT scan slices and good imaging equipment in the lab or in the operating room. I want to say a story. Mr. X, 65 years, smoker, non-diabetic, and he feels abdominal pain and discomfort for 6 months, and also passed a lump in the abdomen. On ultrasound says that it is the abdominal aortic aneurysm. CT scan was done for the treatment plan or the patient preference, and the patient preference, strong patient preference, and also cost effectiveness. We should do. We have done the open surgical surgery, and in open surgery we have done the long incision in the abdomen from G5 process to the crossing the umbilicus and up to C5 SPVs. And this is the parabolic view showing that large aneurysm in the abdomen, and graft was showing in the aorta and also the external artery, and graft is showing, and there is a aneurysm sac was covered the graft. And so I want to conclude like that. On consideration of age, life expectancy, mortality, morbidity, cost effectiveness, open surgical repair of abdominal aortic aneurysm is safe and effective alternative to EVAR. Early detection of abdominal aortic aneurysm through screening and timely effective repair, we can prevent aneurysm related death. Thank you all.